said I am only
Hello everyone, this is Alyne Tamir all the way from Singapore, and keep listening to Dr.Ayesha Mughees on Galaxy Radio Namibia.
Hello everyone and welcome to the health segment of Galaxy Radio. This is Dr. Ayesha Mughees with the topic Hepatitis. Hepatitis is an inflammatory condition of the liver. It should be noted that a condition having the term itis, that is ITIS, at the end of it is an inflammatory condition. For example, peritonitis, pericarditis, arthritis, etc. Hepatitis is caused by a viral infection mostly, but may also occur as a secondary result of medications, toxins, etc. There is another type of hepatitis called autoimmune hepatitis. Hepatitis may occur due to contact with blood or body fluids of an infected person. One type of hepatitis may be spread via an infected person's needles, razors, or toothbrush. During childbirth, an infected woman can pass the virus to her baby too. There are 5 types of viral hepatitis, that is, hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Some of the common signs and symptoms include tiredness, abdominal pain in the upper right area, nausea and vomiting, constipation, fever, loss of appetite, joint pain, dark urine, clay-colored bowel movements, itching, yellowishness of the skin and whites of your eye. The treatment is based on the type of hepatitis you have. However, antivirals is the common term used to treat all. If you feel any of the signs and symptoms discussed, you should visit your doctor. And this is all for today. Goodbye.